Welcome to Bloom. In this video, you will learn useful information about genetic testing for potential immunodeficiency disorders. While the types of immunodeficiency disorders can differ, the common theme among them is that all of them affect the immune system. Primary immunodeficiency, PI, is a term used to describe more than 400 disorders. Although they all have differences, what these disorders all have in common is that they cause the immune system to malfunction, and in some cases, even make it harder to fight off infections. Yes, PI is a chronic disorder that causes the immune system to work improperly, thus leading to an increased chance of infection, which can vary, making the PI diagnosis a tough task. Primary immunodeficiency is usually inherited, which means it may run in families. However, some of the disorders may be caused by both genetic and environmental components. Your genetic makeup affects the color of your hair, skin, and eyes, and how your body responds to bacterial and viral infections. A genetic mutation might indicate an immune system issue, making the body less able to fight off infection. The Bloom immunodeficiency test will reveal whether the infections you are now experiencing may be a result of a hereditary condition that affects the immune system's normal function. This is why laboratory studies are necessary to determine the presence of primary immunodeficiency, PI, usually prompted by an individual experiencing some clinical problems, particularly recurrent and/or chronic infections. Your medical history and profile of infections direct the appropriate choice of the laboratory test. The Bloom process begins with a medical assessment done over the phone to determine the type of infections you are suffering from. The assessment is completed under the oversight of a certified licensed physician. If, in their professional opinion, there is a risk pattern, the medical review officer will send the medical assessment to your primary care physician, along with a request to authorize the Bloom immunodeficiency test. The Bloom test must be ordered by your primary care physician. Then, at no additional cost to you, a specimen kit with a straightforward cheek swab is delivered to your home by Priority Express Mail. Once it arrives, a counselor will call you and walk you through the process, and you will simply mail the specimen kit back to the lab. Then, the laboratory performs the genetic test, and those results are sent to your primary care physician. Personalized medicine, or the tailoring of medical treatment to the individual characteristics of each patient. This approach relies on scientific breakthroughs in understanding how a person's unique molecular and genetic profile makes them susceptible to certain diseases. The exciting impact of personalized medicine advancements on patient treatment is that they will give your doctor tools to address immune dysregulation. Your doctor can use the Bloom immunodeficiency test as a more accurate tool to choose a medicine or treatment plan based on your molecular profile. Regardless of the type of results you receive, they will be shared with your healthcare provider. This can help you, and your provider can use these results to create a personalized treatment plan specific to you. Learn more about the Bloom immunodeficiency test by visiting our website at www.mybloom.life.